Hello friends, I am Dr. Chhavi Gupta. I am Senior Consultant Infectious Disease Specialist at Yashoda Super Speciality Hospital, Kausham. So tuberculosis TB can be of two types. It can be pulmonary or extrapulmonary. Pulmonary means TB of what we say of lungs or the chest, and the extrapulmonary is TB of affecting any organism beyond lung. So for tuberculosis diagnosis involving lung, that is a pulmonary TB, the diagnosis is not a very difficult thing. But for the extrapulmonary TB, that is EPTB, the diagnosis is difficult because sometimes we do not get an accessible site for any biopsy. Sometimes symptoms are not such that it can be diagnosis can be made. For example, CNS TB, and the specificity and sensitivity of the available diagnostic test for diagnosing EPTB is not very high or very good. So these are some of the challenges in diagnosis TB. Now regarding the advancement in the diagnosis of the TB, earlier we used to rely on the conventional microscopy, that is a microscopic detection of TB bacilli in your smears, which we used to see through the naked eye. So the sensitivity of this diagnostic conventional microscopy is very poor, and sometimes it is TB bacilli are missed. Now we have a very advanced molecular diagnosis like cartridge-based test like GeneXpert, TrueNat, which can easily detect very lesser load of TB, also TB burden in the particular sample. And now we are moving towards the whole genome sequencing, where even we can detect even a single bacilli. These whole genome sequencing tests are somewhat very costly and not available everywhere, but at the very bigger centers, these tests are available and can be done in some of the few cases where the diagnosis of TB is really a challenge. So the individuals can prevent themselves by maintaining good hygiene. Now your BCG vaccination is given at the birth. It is for to prevent TB. So people are advised to get their child immunized with BCG vaccine as they are born in the hospital, and these are easily available at the hospital deliveries. Prevent latent TB, the all should be vaccinated with BCG vaccine at the birth. And now there is a term called latent TB, in which the TB bacilli is present in the body, but it is not clinically significantly manifesting into the TB. So the Government of India has launched the program to treat latent TB before it could convert into a clinical disease. So for all patients having latent TB, especially immunocompromised patients, they can prevent by getting the preventive therapy, that is a TB preventive therapy, also called as a treatment of latent TB. So because of the inappropriate, injudicious use of the anti-tubercular drugs, people are not following the drug prescription, they are not adherent to the TB drugs, and they are leaving the treatment in between. All these factors has led to the emergence of your drug-resistant TB. So all these sometimes TB drugs are used for other patients, also for other indications. That is also contributing to the emergence of the drug-resistant TB. And as far as India is concerned, around 11% in the pre-treated cases, TB drug resistance is present. Now for making the treatment of drug resistance easily accessible, we have few drugs which are present at the government nodal centers, and now government is also making partnership with the private hospitals, like under the public-private partnership, to make these treatment available to the people in the private sector also. And the diagnostics has improved to such an extent that now the diagnosis of drug-resistant TB can be made. So yes, we all know that TB in India sometimes still few set of people or few section of society consider TB as a stigma. They do not come out openly to take the treatment, or they are not accepting the fact that they have a TB. So these are creating some of the social impacts. And regarding the economic impact, like TB is also considered as one of the deadly infections, that it can lead to the death of a patient. That will also lead to economy effect, loss of manpower. And regarding for the duration of treatment, sometimes the patients are not going to their work. So these lead to manpower loss or indirectly affecting the economy. So my message to the TB patient is that TB is a curable disease. It is not a social stigma. Free drugs are available in the government setup, and even in the private setup the drug treatment cost is not very high. So kindly shed off your stigma and your fear and come out for the diagnosis of the TB. Now with the new advancement, we have a very good diagnostic and we have a very good drugs available for the treatment of TB. Now we also having the treatment of latent TB, that is a TB preventive therapy, especially in immunocompromised patients. So such patients should also come out for the treatment of the latent TB. And for the TB patients, the Government of India has also rolled out Nikshay Poshan Yojana, where if the patients enroll themselves in the TB program, they get some benefits to improve their nutrition. So my message is, please shed off your fear and stigma and come out openly for the treatment of the TB.